excited to be able to introduce Satellite Med. Wilson's going to speak to us. He's going to share with us how he's equipping local physicians to be able to provide great service treatment in the community in rural America.
Thank you very much, Tommy. And thank you, Steve, for the invite. And thank you, Katie, for that beautiful segue. I feel like as she was talking, I was hearing more and more about the importance of fiber, the importance of broadband internet, how my company, Intellectual Care, probably wouldn't even exist if it wasn't for broadband internet. And really, whenever we were initially asked by Steve McPherson to come down here and speak, I was a little confused. You know, some of you may know about telemedicine, some of you may not. It's a heavy hitter right now. Everybody's trying to get ideas about it. Everybody's trying to know about it. This was something, and this is how this presentation is going to go. I'm going to give a brief background of my history, a brief background of Satellite Med, and my father's history, why he started the clinic. After I graduated from Princeton University in 2010, I've always wanted to help people. I have a father as a doctor, a mother as a nurse. I'm like, I have to go into healthcare. Like, I'm going to med school. And after I graduated, I came back to Cookeville, Tennessee to do my post-bac at Tennessee Tech. Started working as a scribe at Satellite Med, my father's clinic. And I saw so many gaps. Satellite Med was one of the first urgent care clinics in the area that separated from the hospital and started to offer community solutions for the patient. So I started to see a lot of holes in care. Why were patients presenting with a sore throat and it's taking them 3 hours to get discharged? Why are patients presenting with these simple illnesses and still going through all of these old hoops like it's 1970s healthcare? You know, to me, this is somebody from this generation, this millennial generation, if you will. I believe healthcare has to go in this direction. Whereas ever since we started this and we founded the company in 2013, but it really started in like 2010, as I'm seeing all these frustrations, really started to try to figure out how to solve these problems, how to solve these real issues. And frankly, everyone that I talked to at the time laughed at me. All these big docs, all these big people we would go and talk to, they're like, telemedicine, like that's never gonna happen. Like treating patients from wherever they are, like come on, how is that gonna work? Luckily, I have a father who's also an entrepreneur, also a dreamer, and I have a mother who's very practical. So it kind of keeps me grounded, but also with a foot in both spaces. So in 2011, whenever we really started to pursue this, it happened to align with when Twin Lakes brought fiber to our area. And it blew my mind hearing Katie speak, and then also doing research after we were invited down here. I'm like, I didn't even realize that fiber and broadband internet had an effect on me personally, coming up with this idea and then trying to implement it and make sure that it works. So you know, we are strongly in support of these fiber initiatives. What we love and what we've continued to hear ever since we've been here is this idea of local. You're going to constantly hear local from us. That's all we're about. We don't believe in, when most people hear about telemedicine, they think video conferencing. Like, oh, I can video conference somebody from wherever. And believe it or not, we have missionaries in Madagascar, we have missionaries in Brazil that we treat via telemedicine long distance. However, we don't believe that's the long-term solution for America, frankly. Telemedicine has to be localized. And as Tommy alluded to in his intro, hospitals are closing down, rural hospitals are closing down. You've probably seen it in your own community. Rural clinics are closing down. Why is that happening? It's not because there aren't patients there. It's because patients have access to other forms of care. And be it a national telemed company, and this is this big problem that we're trying to solve. Our main competitors, and during our time of launch, 2012, it was my goal to have Satellite Med's doctors treat everybody in America. I'm like, okay, well, we're just gonna, and then he's like, no, we aren't able to do that. Like, we don't have medical records on these patients. So because we had our ear to the provider's heartbeat, at the same time as I'm pushing all this new software and new technology, it really helped us find this sweet space, if you will, where the patient gets maximum care, doesn't lose quality because they're having telemedicine with their local doctor, and providers are able to keep and retain their own patients, therefore stay in business. That 20 to 30% of healthcare that's being seen by national telemed companies can now still be seen by local docs. So I'm going to pass it on to my father, Dr. Cates. Satellite Med started in 2006, and he can talk a little bit about when he started Satellite Med and his purpose to really change the healthcare in the local community. You have that one.
I really appreciate this, y'all, and we'll try to make it as brief as we can. I actually board certified physician currently, fellow with the American Academy of Family Medicine, also a part of sports medicine nationwide, and just had a great interest to deal with the acute care. So I left residency and went right into doing treating patients in the emergency room. And I stayed in the emergency room for 19 years total. But in 2003, I remember patients, friends bringing bills that were out of sight from the ER, and also getting fragmented care because they're bouncing around from this doctor to that doctor, and very disturbed by that. So I sat down one day, and I'm going to be sincere with God's help, started to write down some things. So I ended up on Mayo's doorstep in Rochester, Minnesota. Shared this with a guy who's since passed away with pancreatic cancer, by the name of Rick Colvin. And Rick said, look, I've dealt with physicians at Mayo for a long time. We're the top clinical place for treating people. The physician or the provider has to stay in charge. What's going to happen is insurance and everybody else is going to try to steer it in a different direction to save money. It's not going to keep it about the patient. So he saw the diagram that I had out to try to set a clinic up. And so he said, dive into it, and don't worry, it's going to work. I didn't know in the background that he's the one that started Minute Clinic and some of these smaller urgent clinics. But he said, we're only going to treat 10%, you're going to treat more than 50%. So we opened the clinic in 2006. We decided to focus on the poor and the uninsured. One of the biggest things that we did is we didn't take any government insurance. Mayo recommended that. That took the handcuffs off, and now we can start administering care at the lowest price with the best quality. And today I think we have more than 90,000 patients. We've had over 400,000 visits. The dynamics of that is, that's just the start. And when we recognized how crippled we were until broadband came in, when it did around, what, 2012?
2011, 2012, yeah.
Right, okay. We realized that now we could send the images to the radiologist, get them back, 10 minutes. We could get those reports back, patients could get faster care. It actually helped us decrease the number of employees that we needed to carry paper from one place to another. We could also communicate with the specialists. So we've gone on now to develop this to where we have some of the best specialists in Nashville. We're 85 miles from Nashville. They can actually come into the clinic through telemedicine, and so the patient don't have to travel. We can do pre-op, post-op, and other consultations that way. It also decreases the cost, but it allows the patient to have the contact. The big issue for me is that we see that healthcare is going this way, and Wilson actually took some of our problems and built them into a vision to establish telemedicine. The telemedicine that we do is a lot different. It's not video conferencing. And one of the things we wanted to share with you all, it is the future of healthcare. So let's say where I live is Clay County, Tennessee. Y'all may be able to look that up on the map if you don't know where it is. I have DSL at my house. I cannot do telemedicine from my house. I have to either go to town or go to my clinic, which is in Cookville, because there's no broadband. And so what I'm proposing to you all is there's millions of dollars of grants. There is a great opportunity to include offering a service that might allow those that are stuck on opioids or other drugs, alcohol, whatever, to now have access to health care and branch out as little fingers into these communities and give them an option to have access. And so that's going to help the community survive by giving them the option for health care, so that the local doctors that the people in those communities trust now can consult the best specialists. They're not going to have to travel, but minimal, maybe for surgery or whatever. That's the way it's going to go, but I think we have to realize that it really starts local, and I think most of the telemedicine companies are trying to just get a lot of money and send the money out of the communities. Our interest has been to build it in the local communities, and I know that's what y'all's heart is, and that's what it's been such a privilege since Steve asked us to come, because I think we have the same heart. We have the heart to serve, and we have the heart to make a difference. So I just thank you for the opportunity. I'm going to turn it back over to Wilson and let him.
And so just kind of to pick up where he left off. So in 2012, this was a pretty crazy time for us in Cookeville. I had just built an iOS app. If you guys remember 2010, 2011, apps were just all the rage. Everybody wanted an app. And so we immediately built an iOS app, and we were like, we're going to launch this nationwide. We're going to beat everybody to market. You know, we had all these bells and whistles, this wellness feature, the ability to already share your information to Facebook or any social media platform. You could manage your own medical record. And probably the most unique portion was you would answer a series of questions related to one specific ailment for our providers to treat your issue on the back end. In 2012, when I looked at our competitors' software, I saw that it was just a video platform. And frankly, every one of our competitors, and still people today, they hear telemedicine and they're like, oh, you're just talking about video chat, right? No. We are talking about delivering quality care to patients from distance. And so during this time, whenever we got fiber, we saw that telemedicine was possible. But we didn't want to be like everyone else doing telemedicine. So we chose, rather than releasing this big product and, you know, chasing this 1 year, 2 year financial gain and risk all these malpractice lawsuits that Teladoc and Doctor on Demand are currently in right now, we were like, look, we're going to release this to the Upper Cumberland community. We're going to release this to our own patients, the satellite med patients. And we're going to try to utilize other connections that we have in the community to build and establish these relationships to help satellite med sustain itself in the Cookeville community. Because if satellite med closes its doors in Cookeville, uninsured patients wouldn't have anywhere to go. Patients with extremely high deductibles wouldn't have anywhere to go. And frankly, those patients that actually care about their own outcomes and care about their families, and you know, I'm not trying to toot his horn too much, but what he's done at Satellite Med is he's been able to create the medical home. So what my mission has been was to offer him the mobile medical home and the workplace medical home. In order for our providers to get ready to start treating patients this way, as I'm handing them the software, and our providers are saying, okay, what are you talking about? Like, you mean I'm going to have to start treating these patients? We had to take baby steps. So what we started with was a workplace model of telemedicine. And frankly, in regards to Satellite Med, by the end of the presentation, I'll talk about everything that we're doing now. What we started with Satellite Med, what's currently in operation, are two products. We have a workplace telemedicine product and we have a mobile telemedicine product. The workplace telemedicine product, we supply a medical assistant to go on site to a person's place of work. We build a little clinic. In some places we've used an old closet, and we put hardware to be able to have telecommunication technology. We give that nurse or that medical assistant who's on site the ability and train them to take all vitals, listen to breath sounds for the patient, and we also give them the ability to run diagnostic testing on site. So what has that done for the community in Putnam County? Let's see. Okay, so our initial clinic that we ran was for a workplace telemedicine clinic at Tutco. And you can see how dated this video is. Back in 2014. Bear with it as it loads.
My name is Charles Fulmer, and I do the health and safety here at Tutco.
Everyday working people have everyday health problems. At Satellite Med, we are focused on the individual, the patient.
I didn't realize I was having maybe a pretty mean day as far as stress.
They told us they were going to launch this. It's going to be something good for us. You know, so we can do it while we're at work. We can get our medicines here and be a lot more convenient for us.
It's not always easy to go to the doctor. At Satellite Med, we provide an on-site medical clinic so you can go to work and see a doctor.
so why don't you go try the satellite med and let them take a look at you? Well, how's this going to work? Because you're not really seeing the doctor, you know, it's over a video.
Satellite Med offers the most state-of-the-art form of telemedicine by combining an on-site nurse with modern technology, so you feel like you're in the room with a physician.
So we went in there and talked to the nurse in there, and she took all my vitals, and they were concerned with my blood pressure being high.
My airway was closing off because of infection.
The board-certified doctors at Satellite Med value the patient's safety above all else. If we feel your symptoms require further consultation or treatment, we will immediately refer you to be seen by a provider at Satellite Med.
They asked me if I would go over to the clinic and actually let them maybe check my heart.
And they sent me straight to the ear, nose, and throat doctor, and I had my tonsils taken out to drain all that infection.
We are all about the patient. Our goal is to provide quality, immediate access for patients in need while not compromising their success and well-being at work.
For me, it really was a life or death situation, and they saved my life that day.
Okay, so what's crazy about that video, and I just remember this, those were our first 2 telemed patients. Literally, the first patient came in, health coordinator for Tutco, wanting to test out the software, and he's extremely hypertensive, like falling, like not compliant, not taking his meds, and we immediately sent him 5 minutes down the road. That's the benefit of localized telemedicine, is that, hey, when you get referred, you know where you're going. You know what doctor you're going to see, and your visit is pretty much halfway over. That carryover payment that you initially paid is applied in person for the exact same visit. So the patient actually isn't at a loss at all by going in to be seen. In fact, they're able to get much higher quality care and better access to the provider. So that was at Tutco Incorporated. That was our first beta site. Tutco Cookeville won the National Wellness Award for their entire corporation in 2017. They also didn't tell us about that, I think, to kind of keep their rates low, because we were doing everything for them as you know, as our beta site. We still have a good working relationship with them, and we're still working with their employees. That grew to us contacting the school board, and actually the head doctor over the school board contacting us for the Putnam County school system. They have 26 schools in their entire school system. And they said, look, we hear what you're doing at Tutco. Is there any way we can get you into the schools? So, you know, worried about liability, worried about risk, I said, sure, but we're not taking care of kids. I was like, we'll take care of faculty, we'll take care of staff, but I'm not gonna touch kids, bottom line. And, you know, we actually did that for an entire year, had great success. We were treating all the teachers and faculty in the entire school system with one clinic location. And the reason why that was so good for the schools is because when their employees were sick, they go to school to get their needs met. And they go to school to get their medication. So if they're actually sick, then they actually go home, and it creates this well population within the schools. Rather than people, you know, hanging around still trying to work through, you know, having strep throat or influenza, they're getting pulled out of the schools right away, which creates a well population, and it's great for attendance. We started to treat kids the year after, and we also expanded to Monterey High School. I don't know if you know where Monterey is. It's still in Putnam County, but it's on the way to Crossville from Cookeville. We expanded from there, and we got Cookeville High School. Cookeville High School is the biggest school in the entire county. They have like 3,000 kids. We just started treating them actually in January. We started treating Monterey just last fall. In February of this year, 2018, the entire Putnam County school system had to close down due to illness. And it was reported back to us. They were like, look, what you guys are doing is working. Because I was worried. I'm like, look, if there's an illness epidemic, we must not be doing our job. And they're like, no, the attendance at the schools that you guys are in is like normal. It's like perfect. But every other school is the sick populations. So what we learned is that a quick diagnosis, strep throat, influenza, those kids that are highly contagious that infect everybody else in the school, whether it's due to negligence from the parents not wanting to take them in to be seen or whatever, the kids are getting taken care of at school, they're getting a diagnosis, and they're getting out of the schools, which creates a healthy population. Very briefly here, Satellite Med Telemedicine, we launched it in June 2017, so we just hit a year mark since that product has been released. Due to our recent contract negotiations with the TMA, we are trying to expand, or they're trying to get us to expand fast, and we're still kind of pumping the brakes on it because, frankly, if you try to scale too quickly, you can lose that quality component, and we don't want to lose the quality component at all costs. We've made some really good connections, though, in Nashville. America's Family Doctors, Dr. Steve Samudrala, he was waiting on the SBMIC approval. He's like, look, if my malpractice covers it, he's like, sign me up. And this guy's one of the smartest doctors I know there in Nashville. He's had like 3 different telemedicine companies, and he just doesn't, he understands how rigorous it is to be able to run a software like this. And he's like, if you're providing it, if you're gonna white label it for me, which as you see here, we give him his own logo, his own color scheme. It's all branded to each clinic's unique branding. A company like Intellectual Care, I'm not trying to be the brand for everybody. And in fact, for those of you that know anything about the actual gaming community, going back to what Katie had said, if you've ever played Madden or if you've ever played NBA Live, they're all put out by EA Sports. So I just want to be the EA Sports of healthcare. I just want to help people create these systems, run it well, let it be their own product. You know, let them offer it to their own unique patient populations, which will help them retain patients. We have a pediatric group in Nashville, internal medicine and pediatrics, Dr. Swar's practice. He is launching in January, and we're really excited about that because it's our first true pediatric group. There's so much synergy here for telemedicine and pediatrics, whether it's a new mom with an infant, whether it's kids that have seen the same doctor for 18 years and then they're going off to college. This is their opportunity to not have to go to the infirmary every time they get sick. They can contact the same family doctor that they've seen their entire lives remotely. Brief map about our current and prospective locations. Didn't include all of them. We've looked. We have contact in the Jackson-Madison area. We have contacts of the greater Memphis area, in the Clarksville area, and also in the Waverly, Centerville area that we're currently working on as well. The ones highlighted around Nashville are Dr. Sam's practice and Dr. Swar's practice. The one in Kingsport, Bristol area is the State of Franklin Healthcare Associates, and the one around Chattanooga is the Galen Medical Association. So our hope is to create these small little niche communities of telemedicine for patients to be able to see their own doctor via telemedicine, and frankly, wherever they are. So thank you very much for your time. I know it might have been difficult to see how we're involved in all of this. Frankly, I was having a hard time understanding it at first. Once I looked deeper and I found out that every fiber or every co-op is so community driven and community focused, to me, this is the sort of population that I love talking to. It's not doctors that are, gonna give me hard questions that I have to divert to him. You guys know about your community. We want to know what works in your community and what doesn't. Is there a need for this in your community? Do you see something like this succeeding in your community that we need to have a conversation? But thank you very much for your time.
Any questions?
We got one right here. Give you a comment. First of all, it was a great presentation.
Thank you, sir.
And you got a great product and a great clinic.
Thank you, sir.
I would invite the co-op folks to look ahead 5 or 10 years. You mentioned one thing, which was the opioid addiction treatment.
Yes, sir.
We have an aging population. People want to age in place, so they're going to be able to in your community. What about certain kinds of surgery? There's enormous technology coming in right now. I've been in hospital operating rooms where doctors are using robots from across the operating room. They're not physically connected except by fiber cable over to the patient. These robots have come in over the last 5, 8 years because they take up less room in the body to do the actual cutting and taping and scraping and all that sort of thing. So it's minimally invasive surgery. It doesn't really take much to envision
5, 10 years down the road, if you have a very reliable broadband connection, we're not talking copper, we're really talking fiber. It doesn't have to be huge bandwidth, although it'll be there anyway. It just has to be reliable. And you look down the road at that opportunity for dying community colleges, all the aging, certain kinds of surgery, ophthalmology, eye surgery is coming in very much right now, in fact. It's basically already a mature technology in an operating room. You just move the patient and the doctor apart. The doctor never looks at the patient. The doctor is looking at the screen and working, his or her fingers are in the robot sensors and doing the work. The technology is already there, but it's not there for your communities. You got to fix it.
Thanks, Steve.
Two-part question. One, you mentioned that you don't take any government insurances, Medicaid, Medicare, because of the issues it creates.
That's the way we actually started, but what happened was we invited Medicare in last summer. And Medicare, when they came in and looked at what we do, they said you're going to have to raise all your prices to the uninsured. You're going to have to get rid of those $300 CTs. You're going to have to get them up to where Medicare is. Otherwise, you'll be fined for every patient that you don't charge the Medicare rate. If you charge under that, you'll have to bring everybody down. So what we did is we split off a part of us, and they actually are doing Medicaid or TennCare in the schools, as well as seeing Medicare patients. And so when we take these out to the docs and offer this platform to the docs, they'll be able to see whoever they want to, because they can set their own prices. We're really set up with such a large uninsured population. It did allow us to move quickly to have best quality and really get there much faster. But I think with his platform, you can use everything, especially now since about 3 weeks ago, Medicare said that they're going to pay us with a face-to-face. I do want to make one really quick comment. And I had a patient of mine who ended up having a stroke, and then he fell, became a quad. Vanderbilt said, "You're out of here. You've had your days," not beating up Vanderbilt. That's just what they said because the insurance wasn't going to pay. So his daughter called me, and we did telemedicine for 17 weeks at home with him. She had a wonderful experience with him before he passed away. He actually moved to Upper East Tennessee. I could talk to the home health nurses and have direct communication with him. She used her tablet with a great camera. We looked at wounds that he had related to bed issues and so forth. He just had a wonderful experience. The family did too because they got to interact. His mind was great, but he eventually succumbed to an infection. But overall, I mean, that was just a glimpse of where we can go, and I think it's really going to change people's lives. Think about the cost of travel. She told me it was $500 she would have to pay, because Medicare wouldn't pay, a private ambulance service to just take him two minutes to the hospital ER. $500 I had to pay cash because the insurance was not going to cover that transportation.
Do you have another question?
Well, no, actually, you answered it. I was more concerned about it, without that, looking at any type of grants. I mean, if you're going to deny the government type insurances, are you going to be eligible for any type of government grant?
Yes, sir.
But that answered that.
Yes, sir. We also met with United and with Amerigroup 6 weeks ago. So I think it's no coincidence that 3 weeks ago the bill came down from the president saying, hey, we're going to reimburse for telemedicine across the board. Because I think they started to see that it was possible.